everyone. Thank you for joining us for our first online education presentation. This session is going to be recorded and will be made available under online education on our webpage. Today we're going to hear from our PHN Health Pathways project lead, Kirsty Rowe. Kirsty is going to provide an overview on health pathways and also show a referral example. Before I hand over to Kirsty, we acknowledge Aboriginal and Torres Strait Islander peoples as the custodians of this land, the Jagera, Jayabal and Jarowa people. I'd like to pay my respect to elders past and present, as well as emerging leaders and to any Aboriginal and Torres Strait Islander people with us today. Thanks, Kirst, over to you.
Thank you. Thank you, everyone. Thank you, Mel, for opening the webinar, and thank you all for joining today. As Mel mentioned, my name is Kirsty and I am the Health Pathways project lead for the PHN. I'm just going to go off camera so that we can focus on the presentation. The aim for today is to give you a brief overview of the Health Pathways project and an introduction on how to use Health Pathways. There will be time at the end for any questions and answers you may have. Oops. And how to use HP, and the access and login information for the relevant Health Pathways site for your region will be provided to you following the webinar. This is what we'll be talking about today. So I will start with an overview of the Health Pathways project. You can see on this slide the home pages for each region's Health Pathways, as well as login information to access the sites. There are 2 Health Pathways sites for our PHN region, Darling Downs Health Pathways and West Moreton Health Pathways. Darling Downs and West Moreton PHN work collaboratively with Darling Downs Hospital and Health Service, West Moreton Hospital and Health Service, and local GPs to ensure accurate local clinical information and referral information. Darling Downs has been operational since May 2018 and has approximately 882 pathways currently localised, and West Moreton has been operational since November 2018 and has approximately 876 pathways currently localised. The pathways available on Health Pathways consists of clinical guidance pages, local referral pages, and local healthcare systems pages. So what is Health Pathways? Health Pathways is evidence-based, locally relevant clinical information, including assessment and management of a range of clinical conditions, clinical pathways, referral guidance for local hospitals, specialists and allied health, referral pathways, support services and resources. It is developed collaboratively by general practitioners, hospital clinicians, and a wide range of other healthcare professionals, including allied health and nursing, and it also contains local information and resources specific to the Darling Downs and West Moreton region. So following on from that, who is the audience for Health Pathways? Health Pathways is designed to be used by GPs, specialists and allied health providers, amongst other health professionals. For GPs, it is designed to be easily used at the point of consultation. It is also very useful for GP registrars. In fact, General Practice Training Queensland, GPTQ, now endorses Health Pathways as an essential resource, recognising the platform's ability to provide both training in practice and education exam preparation support to the next generation of GPs as they develop their skills in primary care. Health Pathways is not a tool for patients due to the clinical information contained within, and access is only for those in the medical and health services community. So I will now go through a short demonstration on how to find information on Health Pathways and show examples of the clinical pathways, referral pathways, and our health system pages. I'm not sure of which region everyone is from, so throughout this part of the webinar, I will be swapping between Darling Downs and West Moreton Health Pathways sites. Just changing to show the screens there. So if we look here, we can see the homepage for West Moreton Health Pathways. Darling Downs looks very similar. On the main part of the page, you can see highlighted in red, current recent health alerts for the area. Underneath, you can see upcoming events with CPD points available. And just to the right of that, there is a list of recently updated or localised pathways. And you can see it has information of whether it's been updated or new to there. Underneath that is just general information about health pathways. So it's always good to just come back to that if you need a bit of information about what is health pathways or just need a refresher on how to use health pathways. And on the right-hand side, you will see a bunch of shortcut keys, including for West Moreton of interest is the referral forms one, including health specialist outpatient referral templates for best practice, medical director and generic templates. West Moreton does refer some of their services in through to Metro South and Metro North and Queensland's Children's Health Queensland. So there's links there to templates for referrals for there. If we just go back to the main part there, there's also a link down there to our Darling Downs and West Moreton PHN website. You will see down the bottom here a send feedback button, and that's available on every page. So if you click on here, you can type in your email address, and you can use it if you have queries on a page, you've noticed, say, a spelling mistake, or if you're a provider and notice that your service isn't listed on a referral page and would like to add it. So you can just put that in the subject of your feedback and then send that through, and that will then go through to the local HHS team to action and follow up and respond to you. If wherever you're in a different page, and say if we go here and you need to go back to the main page, it's just this little button next to Health Pathways there, and that will take you back to the main page. Okay, so I'm going to show the Darling Downs page now, just to go through the table of contents. As you can see, the home page looks very similar to West Moreton. And on the left-hand side here, you can see a list of pathways that have been localised here or needs to be localised, and just with down arrows next to them. So if we look at the surgical pathways, so you'll see here a list of surgical pathways available. And if we go down to general surgery and then go down to gallstones, for example, you can see an example of a page there, and I will go through the clinical and referral pages in further details just following this. So see there, also you may notice on the page here on the left-hand side, some of the pathways are in grey, say incidental liver and spleen lesions. That means that the page is not yet localised or is in the process of being localised. And if you click on there, you will see a yellow banner at the top saying page not yet adapted for Darling Downs. Another way to search is just at the top here. And it's similar to a Google search in that as you're typing, it brings up options for you, and you'll see down the bottom suggested pages. So if we type in physiotherapy here, you'll see, say, physiotherapy referrals, and it will show you a list of referral pages that you can look for that may be suitable to your patient's needs. If we go here to this next page here, back to West Moreton, and we're just looking at a clinical page here now. And I'll just give you a basic overview of the page. I've just chosen cataracts. It's just, you'll see on the left-hand side, the table of contents. It's under the ophthalmology suite, and there's other ophthalmology pages available as well. And you'll notice on the right, there's page information here. If you click on this, you'll see that it was last updated in June 2023. So in general, Health Pathways pages are reviewed on a 3-yearly cycle. So this page should be due for review in June 2026. The update can be done quicker if there's been a legislative change or there have been major changes to other pages within that, say, ophthalmology suite, for example, and then this page will be updated as well. You'll see you've got the title just here, and you'll see where it comes from. It's from the surgical section, the ophthalmology section, and then cataracts. It gives you a little basic overview of cataracts, and it tells you that it's for treatment of cataracts in adults. If you're looking for a children's page, there's a link to say, see eye problems in children. If we look here, you'll find there's drop-down boxes next to it. So every page has background information. This one is about cataracts, and it just gives you some general information about cataracts. If we have a look here, the next section on all the pages is assessment, and it just tells you when the patient comes to you and you can have a look, like you're a GP, you can have a look. It shows you the history, suggests you to ask about their cataract symptoms, and there's a drop-down box to see what the symptoms may be, have a look at talk about their risk factors, and just assess how the patient's vision affects their activities of daily living. And it just gives you an example there of what activities of daily living are. It then tells you in the assessment stage to perform a full eye examination, and it just has drop-down boxes of what these are and explanations there. Then there's a management section. It tells you for the treatment process, like consider an optometry referral, or a non-acute ophthalmology referral, look at risk factors such as diabetes, and every page on Health Pathways will have management with similar options to that. And then underneath that is a referral section, like this one says, consider an optometry referral, or a non-acute ophthalmology referral. So if you click on either of those, click on, say, an optometry referral, you will see here that it contains public and private referral information, and I will go through the referral section on a future slide. So if we just go back here, down the very bottom of the page is an information section. One is called for health professionals and one is called for patients. And that is just some additional documents such as research documents for health professionals, or websites, or documents with information that patients may find useful in gaining more information about their situation, and the GP can guide them to where they can find those documents. If we move on now to the referral pages, I've just chosen from Darling Downs the pelvic floor physiotherapy page, and I've chosen that because it's fairly current. It was updated at the end of 2022, and it contains a lot of information. So if we have a look here, we'll see, again, it has background like about pelvic floor physiotherapy. It has public information here. So for Health Pathways, public services are hospital and health services. So it's referring to the hospital specialists for the public services. Funded services, etc., such as government funded services or other non-governmental funded services, are usually listed in private. And you'll see here that it has checked the criteria to refer. So if you look down here, you'll see, open it up here, there's service-specific criteria, and it will show you their inclusion and exclusion criteria, just to make a more successful referral for your patient. And it just tells you how to refer, what information you need to include. Down the bottom, you'll see the location of the service and contact info and website there. And that's the same. It's broken down into local government areas. So you'll find within Health Pathways for Darling Downs, it's Toowoomba, Southern Downs, Western Downs, Goondiwindi, South Burnett. And for West Moreton, it includes Esk, Springfield, Ipswich, etc. And if we go down to the bottom, you'll see here the private mapping. And for this page, it's broken into services for men and services for women. Again, I'll just click on a service for Toowoomba. Click on the top one. You'll see it's just listed with the name and the location. And in there, it will tell you how they accept referrals. It also has service-specific criteria. and the information for referrer includes clinic times, any fees or any bulk billing that may be suitable. And it has the address of the service, admin contact information and a website, and whether it's a walk-in service or an appointment is needed. This service needs an appointment. You'll also see down here practitioners. So if we look here, so for this service, the practitioner who does pelvic floor physiotherapy is listed there. Her qualification is listed under there, and just also her special interests. So again, it just makes the referral more successful in sending for your patient. It shows here whether they're accepting new patients and whether they're doing telehealth. I will give you a note on the private mapping. So the private mapping is voluntary. So our private mapping team will make contact with the service to ask for information and to gain the most relevant information. And that process takes about 4 weeks. If you do not wish to be included, we will not include you. You just let us know and you will not be included. So that's for that one. And the last page that I'll show you is just our health system. So both sites have a health system, and this is just where general information that is quite important, or you may not fit into a clinical page, but you may want to know, how do I make a complaint to or ask a query of Westmoreton Health? What education is upcoming? Is there a guide to MBS items? So if we have a look through here, we'll see it contains information such as information to the health system and also a map of the areas the health system, the HHS covers. We've got education here with upcoming events. You will find, say, things like the guide to MBS health items that I mentioned. And we've also got general practice GP to GP colleague referrals. So if anyone online does provide any specialist services or any services that, and they're willing to accept referrals from other GP practices that may not have that service, please contact us after this and we will make contact with you to add you through to the service. That's pretty much it, all I have. I will just, there. So does anyone have any questions today that they would like to ask? If there's no questions, please I'll have on the next slide my contact details. You're welcome to contact me with any questions you may have outside of the session. So I would just like to thank everyone for their time today, taking time out of their lunch. This is the first of these lunchtime education sessions. I hope you found this useful. The sessions will be running monthly on different topics and you'll be notified of the different dates via our website and newsletters. If there's nothing else, we will end now, and you've got my slide here. We will be sending out login details for HealthPathways to anyone. If people don't, to anyone on this call, if people haven't received anything, please make contact with the HealthPathways team and we will obtain access for you. Thank you very much.
Thanks, Kirsty. Thanks for joining, everyone.